So that white bright signal is because of the myelin, and so it appears hyperintense on T1 and hypointense on T2. So on T2 the grey matter is white and white matter is black. That's the opposite, right? So because of this lipids and all, the fluid reduces, and that's why the T2 signal reduces. So as there is myelin formation, the presence of the hydrophobic protein and the depletion of fluid causes a hypointensity in the T2 signal. So best seen on 0 to 6 months of age is on the T1 weighted images. Up to 1 year you will see, actually 6 to 8 months is the best time, but up to 1 year you will see these changes of myelination on T1. On T2 there is a lag. So even though it is myelinated appearing on T1, on T2 there may be a 1 to 2 months lag. And the regular subcortical white matter and all, they show it better on the T2. So from 6 to 18 months of age, the myelination will be better assessed on a T2. So how does myelination progress? It generally goes from caudal to the cranial direction, from posterior to anterior, and from central to the periphery. Also, when it is involving sensory tracts, be it visual, auditory, or sensory touch pathways, they myelinate earlier than the motor pathways. In a subsystem, the proximal part myelinates earlier than the distal part. The projection fibers myelinate earlier than the association tracts. So projection fibers are the corticospinal tracts, for example. They project from one area of the brain to long other areas. And association fibers are smaller ones, the forceps major, which connect two areas of the brain. So in the cerebrum, the perirholandic areas myelinate first. These are to do with the sensory reception, right?